Okay, there we go. Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment right now. We've got a shaver coming in, which is what you see on the screen there, and that has suction attached to it, and that's what we use just to help irrigate the joint, wash out anything, and then ultimately to help us see better. As you look back here, here's the meniscus. You can see the meniscocapsular junction right at the edge there. This is the inner edge of the meniscus. That's where it attaches to the joint capsule medially. And as we look back here, that attachment site looks good all the way back. That loose body that we're expecting to find is way in the back, so we'll deal with that in a little bit. But as we push through here, we can even get a pretty good look at the root of the medial meniscus back here. That looks good too. Really don't see any problems there. The articular surfaces look good. The femoral condyle is up above and the tibial plateau is down below. And that looks pretty good. So we're going to stop on the video for just a second. Okay, so now we're looking in the central part of the knee. There's a little structure here that we can trim that'll help us see a little bit better. This is your anterior cruciate ligament. Your posterior cruciate ligament is over here on the right, just behind the shaver. The ACL, or anterior cruciate ligament, starts, let me give you a little better picture here. Comes up from the tibia, and you can see it run up to the lateral side of the notch there. Okay, it's got good tension on it. It was stable under examination. And now we're going to look in the lateral compartment. We'll show you that in just a second here. Okay, so now we're looking in the lateral compartment, and this looks pretty good also. We've got a little bit more wear and tear changes on the tibial plateau. This may be where that loose piece came from. See, there's a little bit of roughness here. We'll just work our way back into the compartment here. But the lateral meniscus here looks good. The root looks good. There is a loose piece right there. See that? Okay. And so we'll make sure there's no more. That one we can suck out pretty easily, so I think that one's gone. Keep bending, bend the knee back up. We'll see if there's anything else back here, but you saw the one. And again, I think it probably came from this lateral tibial plateau. My suction's getting kinked right at the white. See the white at the top there? There we go. Okay. Again, we're just running our suction right now, just making sure that there's no more loose pieces in this posterior compartment here. And so far, so good. I think we've got everything. I'll tell you, even though you're young, this type of chondral degeneration is something that we may be able to help with in the office with some of our orthobiologic injections if you're symptomatic. And so we're going to have to talk about that now that we've got good videos showing what's going on, and now that we know that you're already starting to generate some loose pieces. We want to try and stop this process from happening. Okay, so again, I'm just flushing a bunch of water through. So far, no more loose pieces have shown up. I'm going to try and sneak around here. Nothing over there. Nothing hiding out in the notch, just sometimes where they go. And now we're going to straighten the knee out, and we're going to look up at the patellofemoral joint and the suprapatellar pouch, because this is another place that loose pieces like to hang out. This is the medial gutter. And that looks pretty clear. See the shaver? We'll show you some more in just a minute. Okay, so this is now the lateral gutter, and again, there's no loose pieces over here, so I think we've got everything removed. Now this is back up above the knee. Some synovial tissue, but no loose cartilage pieces. And so we're going to have one last look up at the patella. And sure enough, this is what I was curious about. This may be where loose pieces are being generated also. So you can see we've got some patellofemoral chondrosis here. I don't want to remove anything, but definitely if something's about to be loose, we don't want to have that happen anytime in the near future. And you really are going to be a candidate for some of the things we do in the office, I think. Having seen this on the lateral tibial plateau and underneath your patella, this doesn't look great. And you're so young, we have to try and do something to stabilize this cartilage so it doesn't keep breaking down. You can see the normal cartilage is over here where it's smooth, and if you slowly watch on the screen, this is where it starts to not be smooth. So that's as much debridement as I'd like to do. As I use the backside of this because it's smooth, we can also measure. Those are centimeter markings. So this area is at least a centimeter, really almost 2 centimeters by 2 centimeters on the patella. Okay, so what I've done is I've moved the scope over to the medial compartment, or medial portal, I should say, because I wanted to make sure I could debride the lateral facet of the patella. And so now the patella looks pretty smooth in terms of nothing's hanging down loose. It's not smooth in terms of when you look up at it, you've got these areas right in the middle. But at least I don't see anything grossly unstable anymore. Okay? And so we can track down the front. Trochlea looks pretty good as we look down the front here. Okay, so we are going to finish up here and get you back to the recovery room shortly. We'll see you back in the office, okay? Bye-bye now.